Hi everyone, and welcome back to XGate Dental. I'm Emmanuel, and we are here to discuss new procedures in the field of dentistry. We will provide interesting new cases to exhibit how doctors use our products to solve complicated dental cases, so don't forget to subscribe and follow us to stay up to date. So let's get started. In here, we see the teeth that need to be extracted. The patient has an anterior bridge, and the posterior teeth need to be extracted as well. At first, we need to think about something temporary because both the bridge and those teeth will be extracted and you won't have anything in the mouth left. So what we did is at first we extracted a couple of teeth and placed implants on both sides, on the left, and we don't see the right, but on the right as well. Later on, we need to wait for a couple of months for the implants to be osseointegrated. We can see how he came back. The patient came back with a lot of residue of food. He probably never brushed his teeth since the moment of the implantation. We left this canine to hold a little bit the bridge because the whole interior part of the bridge is without support. It rests on the residue of the teeth that he still has. This is probably better than doing a removable denture. Here you can see that the primary implants you had, it's kind of temporary, all on 4, and 1 canine that was left. This is the canine, and this is the teeth. It's a temporary solution for a couple of months, so if there was a big inflammation or something like that, we could have extracted the tooth, but we need to think about pros and cons of every procedure. So in this case, this is what we chose to do. This way, we could reduce the pressure on the anterior implants. We've added another 2 implants on each side because on all 4 is a little bit problematic, especially if one of the implants will be lost. So you won't have any option to fix anything. So we had enough space to add 2 more implants on each side. This is after the extraction of the canine and after the healing period. We tried to scan and it was very problematic. First of all, it's a lower jaw, so you have a lot of movable tissue. You have the tongue, you have all the uncharacterized gingiva, you have the lip, the cheeks, all the buccal area is problematic, all the saliva. As you can see here, it's very hard to scan the lower jaw, so we decided to use transfers. What we can see here is the plastic caps on those transfers. We chose to do it in this method because we couldn't scan. So we chose to take impressions and then scan the impressions with the scan abutments for impressions. We use composite material because we want all the caps to be embedded in one big unit. So it won't move and it won't deform. With the composite material, we also took the vertical dimensions of the occlusion. We need to know, first of all, the central line where we'll be with the lower jaw and the height of the lower teeth. The technique is basically the same as with wax, but remember that wax is not exactly great because it can deform very easily. If the patient closes the mouth a little harder, the wax will deform, and then the technician needs to work with this deformed wax. When you're setting the wax, if you forget in the car or something like this, you don't have any wax left, it'll just melt. If we remove the piece of composite right now as is, it can still deform because it's a very long piece of composite material. So we wanted to connect both sides. We took a micro brush and broke it and used the micro brush as a holder for the composite material. Very cheap. Here you can see transfers after we removed all the composite material with the caps and with the micro brush. And here you can see the composite material with the caps. In here you can see inside the magnets, and the blue part is the micro brush and all the composite material. We took also the form of the gingiva with the composite material, and right now we want to scan it before doing anything else. We place the same transfers with scan abutments for impressions. These are not the same scan abutments as for implants because in here the scan abutment is like the inside of the jaw in place of the implant. This is the temporary bridge. You can see different kinds of sleeves because part of the multi-units were angulated and part were straight ones. This is the temporary restoration in the mouth. This really looks like one solid unit. There aren't many embrasures because we're afraid that it will break down. The more embrasures you will have, the weaker the bridge will be. We still need to wait a little bit to see the form of the teeth. Thank you everyone that joined in to learn some new and interesting information. Make sure to stay tuned for more, and of course, don't forget to subscribe, like, and follow. Thank you, and see you guys next time.